Fecal microbiota transplantation for recurrent Clostridium difficile infection in the elderly. Long-term outcomes and microbiota changes. Clostridium difficile, or C. difficile, is a bacteria that typically infects the intestines. It is possible to carry C. difficile without becoming sick. The symptoms range in severity and can appear anywhere from the first day of infection to 2 months after. However, symptoms usually occur in 5 to 10 days. The mild symptoms include diarrhea at least 2 times a day for several days, and mild abdominal cramping and pain. For a severe case, symptoms include diarrhea 10 to 15 times a day, severe cramping and pain, fever, nausea, bloody stool, loss of appetite, bloating, and even kidney failure.
So let us discuss how Clostridium difficile is contracted. C. difficile spores are spread by unwashed hands touching food, hard surfaces, or physical contact with other humans. When you overuse antibiotic medication, the antibiotic can kill the good bacteria and leave room for C. difficile spores to attack. The main takeaway here is that antibiotics increase the risk of catching C. difficile due to the reduction of health-promoting symbionts.
The host's immune response begins with the pathogen being ingested and developing within the colon, where it releases toxins A and B. Both the innate and adaptive immune systems respond to the initial and any recurrent infections. Initial CD infection initiates the release of pro-inflammatory cytokines IL-1 beta, TNF-alpha, and IL-8, causing inflammation of the colon. These cytokines begin the activation of monocytes and macrophages, while a severe infection will include a strong neutrophil response. Additionally, plasma cells create antibodies IgG, IgM, and IgA in response to antigens from toxins A and B.
The fecal microbial transplant is prepared by mixing 25 to 30 grams of a sample from a donor and mixing with sterile saline water. The sample is then filtered through surgical gauze to remove large particles, followed by additional filtration. Multiple 90 milliliter aliquots are made of the filtrate and sent to a GI diagnostic center for the procedure. For the procedure, 450 cc, 1.5 cups, are administered during colonoscopy and enteroscopy with a spray catheter. An assessment of the severity of colitis is also performed during the procedure.
Oh my!
In order to qualify for the study, patients had to have been over the age of 65 years old, they had to have shown symptoms of recurring C. difficile infection for at least 6 months, and they had to have failed 3 or more antibiotic regimen. A total of 29 individuals were enrolled in the study between the enrollment period of March 2011 to September 2014. Of the 29 individuals, 13 were between the ages of 70 and 79, 14 between the ages of 80 and 89, and 2 were over the age of 90. The mean duration of symptoms was approximately 12 months. Primary endpoint for this study was defined as resolution of clinical symptoms, diarrhea, bloating, abdominal pain, with a single FMT infusion and negative stool C. difficile test for toxin. Very favorable results were obtained from the study, as most patients reported same-day improvement of symptoms, with a mean symptom resolution of 4 days. All patients reported a minimum 50% improvement in number of bowel movements and diminishing abdominal pain from baseline. The only adverse effect were fever and bloating. Fever was reported by 2 out of the 29 patients, which resolved within 1 day, while bloating was reported by 3 out of the 29 patients. After FMT, antibiotics were necessary to control symptoms for all of the patients. Testing for C. difficile toxin, which occurred 1 to 2 months after FMT, were negative for 27 out of the 29 patients, while the other 2 refused the follow-up testing due to complete resolution of symptoms.
There were 2 primary applications of biotechnology used in this study. At the primary and secondary endpoints, positive resolution of the infection was determined using ELISA and PCR. ELISA was used to test for the presence of toxins A and B, while PCR was used to attempt to amplify any remaining C. difficile toxin B gene.
Thanks for watching!
Don't forget to like and subscribe.